So today is the first of hopefully a series of a virtual town hall for Linn County residents to participate in and ask questions regarding the COVID-19 response. Today's topic is community measures to reduce the spread of COVID-19. We've asked some speakers in our public health and medical community to help answer some questions that people have. From Linn County Public Health, we have Heather Metter, who is the Clinical Services Supervisor, and Dustin Hinrichs, who is the Food and Aquatic Safety Supervisor. From Unity Point Health Cedar Rapids, we have Dr. Justin Arnold, who is the Chief Medical Officer. So the way that we've structured our virtual town hall is that we did have an opportunity for people to submit questions ahead of time up to yesterday. So the speakers will answer the questions that were submitted ahead of time, and then we will take questions from the line. We are going to ask that the questions be submitted via text. And this is in order to reduce the noise on the line in terms of people talking over one another and etc. So if you do have a question that you would like to submit, you can either submit it in the chat function on GoToMeeting, or you can email that to lcph.meetings@linncounty.org, and we will get to those questions as soon as we can. And as I mentioned, this meeting is being recorded and will be posted publicly. We're going to go ahead and get started with the questions that were submitted in advance. The first question is it possible to know where quote-unquote hotspots are in Cedar Rapids, maybe cases by zip code or by place of employment? I would hope people in these areas might be more vigilant in social distancing. Can we be told the number of cases in each community? And I'm going to ask that Heather Metter answer this question. Heather, can you go ahead?
Sure, yes. Thank you for the question. That's a great question. So Linn County Public Health is tracking our positive cases. We are doing this by zip code. We are also aware of businesses and employers and those positive cases. So I totally agree. It's important to know where cases are at. The important thing to remember right now, though, is that we have community spread. So COVID-19 is throughout Linn County. It's throughout the state of Iowa. So at this time, we want you to consider every location a hotspot. And this is why we keep asking individuals to stay home. And if they must leave their home, that they're maintaining that distance of 6 feet from others, and also that they wear a mask when they're out. And again, that mask is not to protect you from others that may be ill, but it's to protect the public from you from unknowingly passing that virus. This is a new virus. It's calling it the novel virus. So novel means brand new. So it's brand new to us. And so we're still learning about this virus, and we're learning about how it circulates. And since we're seeing individuals that have very mild illness, we've also seen some individuals that had tested positive and really had no symptoms of illness whatsoever. And because of that, I want everyone to behave as if everyone that they're coming into contact with has the virus, because we don't always know. So when we're looking at hotspots, that's great information to have from an epi point of view, from an epidemiological point of view. It'll be really good as this outbreak continues to go on and as we look at things kind of when we get to the end of this. But as of right now, everyone needs to think of this outbreak, that every location is a hotspot. And the other thing I want people to remember is probably about 12% of all the COVID-19 cases that we have right now are associated with the manufacturing and industry occupations. So it's also important to practice the social distancing while you're at work. So as much as you can, you need to stay away from others, even in a spot that you think is safe because it's your employer. We also want all Iowans to stay home no matter how ill they are. So if it's a very mild illness and you don't think it's much of anything, we still want you to stay home out of an abundance of caution. So I know that probably doesn't give you exactly what you wanted, but yes, we are tracking those things, but I want you to consider every location a hotspot. Thank you.
Thank you, Heather. The next question that was submitted ahead of time is that if this virus continues to exist after the stay at home is stopped, wouldn't we start the cycle all over again? How do we know when it is safe to go out again? We have a student that is very anxious to go out again. And I would leave it up to Heather or maybe Dr. Arnold to answer those questions.
I can take that, Caitlin. The virus will still exist after this outbreak. However, we will have more people in the recovered bucket rather than the susceptible bucket. So you will see a little spike, but it will be at a reproductive number that's much lower than what it is now, perhaps even below 1. And then the virus will essentially disappear at that time. I do think that we will see a little spike in the fall, but not to the degree nor the concern that we have at this juncture.
Thank you. The third question is the Linn County Public Health Department working directly with grocery stores and other essential businesses that are staying open during the crisis to ensure those facilities are following all applicable recommendations for keeping their customers as well as their employees as safe as possible? And I might ask either Dustin or Heather from Public Health to answer this question.
I can weigh in, Caitlin. This is Dustin. The simple answer is yes, very much so. Linn County Public Health has dedicated staff that are working directly with many different types of local businesses that remain open because they are essential nature. In particular, you mentioned grocery stores. We have many grocery stores in the area that are regularly routinely inspected by our staff here, and we provide a service license. So we have good relationships built up with these facilities already. As this has been a constantly changing and moving situation, we've certainly had to revisit our communications with a number of these establishments to make sure that they're changing as the situation rapidly changes itself. So ensuring that they're following all social distancing measures, in particular, the curbside pickup and delivery methodologies that different places are informing has picked up significantly. Places are adapting very quickly to our instruction, and so I commend them on that. Sounds like my audio is a little choppy. I'm trying to fix that. I don't really know how to, though.
Yeah, Dustin, the audio is a little choppy for you. We might move to the next question and come back to that one. But for those of you on the line that were having some difficulty hearing Dustin, he's stating that Linn County Public Health is working with grocery stores and other essential businesses to ensure compliance. The fourth question is, do you know or believe that most such facilities are in a high degree of compliance, or are you finding that there is a lot of variability in the levels of compliance? Do you think Dustin would probably be the best one to answer this one? Dustin, do you want to try your audio one more time?
I will try. It sounds choppy already.
Okay, we might have to move past this question.
Can you guys hear me? Do you want me to try?
Well, it's better.
Okay, I will weigh in then real quickly.
Go ahead, Dustin. That's better.
Yes, I do believe that most facilities have actually done a remarkable job of adjusting to the scenario that we're in here in Linn County. I think it's been really challenging for them to do so. We have certainly had some reports of some folks that were not adapting as quickly as we need. However, we've been able to follow up with those folks and educate them rapidly on the fly and get them brought back into compliance. A couple of instances have happened, and I'm not going to mention any specific businesses or names, but a couple of instances have happened that we have had to report to local law enforcement. just really to keep an eye on the businesses and ensure that they aren't slipping back into their previous methodologies. But the message I'd like to deliver is that overall, people are doing a very good job. As things continue to change, however, we need to make sure that people continue to pay attention to the guidance that's being delivered from locally here at Linn County Public Health, Iowa Department of Public Health, the Centers for Disease Control and Prevention, etc. So that's going to remain important as we move forward.
Very good. So those were the 4 questions that were submitted ahead of time. We do have some time to open it up to questions that are participating in our virtual town hall right now. As a reminder, if you have a question you'd like to submit, use the chat function within GoToMeeting, or you can email your question to lcph.meetings@linncounty.org. It looks like we have a few in the queue, so we will move to those. I just want to remind you, as you're writing your questions, please indicate who the question is for, if possible, so we can make sure that the appropriate person answers it. And if we do not get to your question during our town hall, we will record the question and provide a written response for follow-up. At this time, I also want to remind our participants that there is a public hotline that is being managed by 211. So anyone can call that 211 for general information on COVID-19, or visit the Linn County Public Health, Iowa Department of Public Health, or CDC websites for additional information. So the one question that has been emailed to us is most likely for Heather or Dr. Arnold. This is the question. If a resident of a senior citizen, retirement, community, or nursing home contracts COVID-19, is the management of the retirement community required to tell the healthcare and food service employees that a resident has tested positive? This person says, I understand HIPAA does not allow stating a name, but just that an unidentified resident has tested positive. Heather, would you be able to answer that question for us, please?
Sure, I'd be happy to answer that one. So when anyone tests positive for COVID-19 in a residential facility, the health department within the county that facility is in is going to be notified of that. We do reach out to the administrators of the facility, and we work with them. We take it very seriously when we see this in a nursing home, because it's a residential community. People are in close contact with each other. So, and I think we also need to remember there's a difference between nursing homes and assisted living. Assisted living is more of an apartment dorm-like setting, where a nursing home, it's much more of a residential facility with people living together. So, but yes, we do work with the administration of that nursing home, and we do want that out there. We want them talking to their staff, because it's going to be pretty obvious that something's going on, because we're going to be doing a lot of recommendations. There's going to be a lot of changes. We're going to want all the residents to remain in their rooms. We're not going to want anybody dining together in the dining room. We don't want any mixing of residents in the hallways. So we're going to be isolating all residents to their rooms. We will also be looking at any other residents that would be ill, so that we may be moving residents around, cohorting ill from well, working with staff members, doing different things with personal protective equipment. So it's going to be pretty obvious. So food staff, janitorial staff, everyone should be aware of it, because there would be many changes coming. And this is not something that we'd want to have hidden from other staff members in that facility. However, I will say that there have been facilities that we have worked with where they may have ill patients. We have tested them for COVID-19. It may be that they all come back negative. So it could be that you saw things going on in a nursing home, but then there was nothing there. There was no COVID-19, but out of an abundance of caution, we did have testing done just to make sure that whatever respiratory illness was going around was not COVID-19. So, but if we have a case of COVID-19, I would certainly hope that the administration would be there to tell you. You're going to see lots of things changing, so it should be quite obvious if there is a case of COVID-19 within that nursing home, because we would also be doing checks for all staff members that work within that nursing home, doing temperature and symptom checks, and working on personal protective equipment. So I hope that answers your question.
Okay, very good. I just want to remind everyone to please mute yourself. If we continue to have a little bit of background noise, I will have to mute all and then just open up the lines individually for the speakers. So please mute yourself if you have not already. We do have a couple more questions in our chat queue here. There's one that is a little bit long, so I'm going to try to interpret the question here. It says, based on numbers as of this morning, it appears that approximately 40% of the Linn County cases are related to the Heritage Nursing Home. It appears that this particular outbreak has been fairly well contained. Do you think this is the case or not? Also, if this is the case, the Heritage cases may be a statistical anomaly. Has there been any analysis of the Linn County metrics with this in mind? And what does that show in terms of the effectiveness of social distancing and other measures being taken? Let's see. And then I guess this is the question that this person is trying to ask. Based on the numbers as of this morning, it appears that approximately 40% of the Linn County cases are related to the Heritage Nursing Home. Oh, this is just a repeat. My apologies. So, Heather, would you like to reply to this question about if the outbreak at Heritage Nursing Home has been fairly well contained, and what does our Linn County metrics show in terms of the effectiveness of social distancing and other measures being taken? Or Dr. Arnold could answer this as well.
Dr. Arnold, I'd like to weigh in on it first.
Yeah, no, go right ahead. Mm-hmm.
To say if it has been contained, absolutely. The fact that we've had if you think about all the vendors, therapists, family that visit nursing homes, and to have it not spread to nursing homes is a reflection on how quickly Heritage, Public Health, and Mercy provides the medical directorship at that nursing home got on this and contained it. So I think that's a testimony right there to reacting quickly, and it does throw our statistics off, but it could have been a lot worse, and they've done a great job of containing it.
Okay. Thank you for your responses. The next question says, for the benefit of our listeners, can we explain why grocery stores are utilizing the physical plexiglass barriers that help to keep staff safe, and how does this help do that? Also, what other measures grocery shoppers can utilize to minimize their risk of spreading anything they may have while they are shopping? Do one of our speakers want to take that question?
I can take a stab at it. This is Dustin Henricks. So the plexiglass barriers that you're seeing at a lot of different retail stores, they're starting to implement. Ultimately, it's a physical barrier they're providing. As we know, COVID-19 tends to spread through droplets that are formed and transmits through the air via coughing, sneezing, etc., or spittle that comes out of the mouth, coughing even. So the idea behind the physical barrier is it protects both the customer from the cashier's interactions and vice versa, protects the cashier from the customer interactions. So that's the key idea there. Certainly when paying, as far as other things that you can do, to make your shopping experience safer potentially, when paying, I think many stores are currently not accepting cash. So certainly focusing on utilizing something like a credit card, which is made of plastic, which can be disinfected after uses if need be. Or online payment is another great option. I know some of the grocery stores in the area have now implemented online shopping options. I recommend people look into that. It's kind of a useful approach to grocery shopping, and obviously it can also keep you completely from going into the store environment. And that also protects the employees at the store because they're at least limiting the number of people that are coming in and going out of the grocery environment. Other measures, grocery stores for years now have put out disinfecting wipes to utilize on the carts, the shared touch spaces throughout the grocery store. Certainly utilize those. The utilization of face coverings as well is important. You've seen a lot of news media coverage on that recently. So we do recommend some sort of a cloth face covering when you go out into a public space. If you're going to be in an area in particular where there's lots of individuals that may be, then there may be more potential for the spreading of viruses in those environments. So we're certainly recommending that folks do that. In particular, if they can make a homemade mask themselves or some sort of a face covering, even a bandana will serve some level of protection when you're out in public. And, in particular, when you're in areas where there's going to be lots of people consolidated in a small space. I think that covers most of the pointers that I have on that. Heather or Dr. Arnold, I don't know if you all have anything else to weigh in it.
No, I think you covered everything, Dustin.
Okay, very good. This next question is from Brian Tabak. This is one of our media partners. This question is for Heather. And I believe for Heather's knowledge, this is a statement that Linn County Public Health recently released to Brian regarding his question. So this is the question. After someone tests positive for the virus, obviously we are not able to be there. What does that conversation look like? Are there legal modifications for not staying in your home? And how is this being enforced?
Thanks for the question, Brian. So local health departments contact all laboratory confirmed cases of COVID-19 to conduct an investigation and identify close contacts that may have been exposed. After confirming the diagnosis with a healthcare provider, the local public health will conduct an initial interview and provides education on how to stop the spread of the disease, which includes self-isolation instructions. If a person is not going to be compliant with the self-isolation instructions, the local board of health, so it's the board of health that has the authority to issue a legal order for that individual to stay at home. The Linn County Board of Health has not had to issue such an order for any Linn County residents. If an order is issued, it is enforceable by local law enforcement, and local public health would be checking in regularly with that confirmed case to make sure that they are staying in the home. So I hope that helps to answer your question.
Thank you, Heather. I have a few questions that have been emailed in that I'll read. The first one is, are there any plans being developed to expand community testing? The president says the federal testing centers are being closed. Do we have a response to this question, please?
At this time, I don't. Go ahead, Dustin.
Union Point Health has expanded testing capabilities on the outpatient side. We continue to use Path Lab in Des Moines as well as the Iowa Department of Public Health lab in Coralville. But I'm not familiar with any other capabilities to testing. Certainly anxious to have an expansion of testing, particularly the rapid test that they are talking about. But I do not have any direct knowledge of expansion of public testing at this juncture.
And I do not have any knowledge of any expansion on testing either at this point in time. This is Heather. There may be some additional testing that may be able to occur during an outbreak situation in a given facility, such as a nursing home facility, where we might expand some of the testing that we're doing. But for the general public, at this time, I've heard of no plans for expansion. But again, agreed, looking forward to these rapid tests that should be coming, but I have no idea of when or where or how that will be done.
So if you decide you want to try and go in the little cupcakes or something there and cherries or around here, we're all like, so we're like, okay, we'll choose a right.
Okay, we're getting a little bit of background on the phone, so I'm going to mute that caller's line very quickly. Okay. So I have one other email that came into us that I will read. This question is, I believe the incubation period has been stated to be up to 14 days. I interpret this to mean that if one not later develop symptoms from that original exposure. But if the exposed person is going to contract the disease with symptoms from the initial exposure, what is the average number of days after exposure that symptoms would start to occur?
This is Dr. Arnold. The average is 5.1. Antibodies form at 14 days with a range of 10 to 18 days after exposure and illness. So you're correct. If you had an exposure and for 14 days you remain symptom-free, the chance of you being infected from that exposure is quite low, if not zero.
Okay, thank you for your response. I'm just looking through our chat box here to see if there is any questions that we missed. I believe that we got the ones that were emailed to us, and so I'm just checking one more time. We would like to wrap this town hall up at about 12:30 to allow our speakers to get to their other obligations. Here's a couple. How regularly are people who have been tested checked on? Is it difficult to monitor all of the cases? I believe this question is for Heather.
So we try to check on people that have tested positive for COVID-19 on a very frequent basis. We were doing it daily. Obviously, our numbers have increased, so it's a little bit harder. So, but we are doing frequent checks throughout the duration of the illness for anyone that does test positive for COVID-19, and we continue to do those checks until they have been deemed as recovered from the illness. So, and that time period has a wide range from anywhere from maybe 8 days on up to over 20, depending on how ill that person is. For those that seem to have more severe illness, more of a moderate to severe, we do make sure to check in with those individuals daily. For those that may have a more mild illness, it may be every couple days. Thank you.
Okay, and it looks like we have time for one more question. This question is for Dr. Arnold. Do you know whether someone that has been infected and has recovered can catch it again?
They cannot. There are case reports from Singapore and China of people testing positive, testing negative, then testing positive again. And that is probably because it was a false negative in between. Immunity is, like I said, the antibodies develop at about 14 days with a range of 10 to 18. And immunity probably lasts at least 3 years, which will be time enough to get a vaccination.
And we have one more quick question I think we have time for. The question is, Mayo, I believe Mayo Clinic is the reference. Mayo is developing serum testing so immunity can be tracked after we're through this. Do you know if that will be available here?
I can speak for UniPoint Health. I think Mercy might use Quest Labs, but we use Mayo as our reference lab, so yes, we would be able to order that test. Mayo has also developed a protocol so we can use convalescent plasma, and we are part of that protocol, and we'll be moving forward with that, which is exciting. But that test will be available, correct?
Okay, very good. That is going to conclude our virtual town hall for today. We thank you all for attending and listening in. As a reminder, this town hall will be posted publicly. The recording has, we have recorded it for today. Thank you very much to our speakers, Dr. Arnold from UniPoint Health and Dustin Hinrichs and Heather Metter from Linn County Public Health. We do plan to do these virtual town halls moving forward on Fridays. The next topic that is being planned is mental health and COVID-19. That will be Friday, April 17th. The time may change depending on the availability of the speakers, but we do plan for it to be on Friday the 17th. Thank you so much, everyone, for your participation today.